you should have access to it now. So you guys have telehealth in like November 3rd. That is terrible. November 3rd, I believe. Whatever day is on your clinical schedules when you're coming, and you're all coming at the same time at 3 o'clock. So you don't have a schedule. So we're going to kind of look through this page, kind of talk about it because it's a lot. And just make sure you understand kind of what we're going to do and what you need to do prior to coming to telehealth. All right, so first of all, what is telehealth? This is a simulated psychiatric interview. We partner with students from Auburn's College of Nursing, so we will all be in the same session together. We'll go into a big session, and then you guys are going to be put in breakout rooms, and you'll be with a student at Auburn. You're going to take turns role-playing the role of the nurse and the patient, so that everyone gets the chance to be the nurse and conduct an interview, and everyone gets a chance to be a patient and really kind of experience what it's like to have these illnesses. All right, because of all that, you have a lot of preparation to do before you come to telehealth, because once we're there, you kind of got to be ready to get up and running. So let's talk about what all you need to make sure you have and what you need to do before you come. Okay, so you have to have high-speed internet and stable internet. You need a device that has a camera and microphone. Those have to be on the entire time. And you need a quiet space to do this clinical. If you don't have all those things, or you live out in the middle of nowhere and your internet's real sketchy sometimes, just let me know and we can arrange for you to do that here at campus. All right, I do need to know ahead of time though, so I can make sure I have a space and a computer ready for you to go. All right, you are required to be in uniform for this clinical. I'm probably only gonna see the top, so I don't care what happens on the bottom as long as I don't see it. Just make sure that whatever I see in the camera is uniform, okay? All right, prior to telehealth, what do you need to do? There's lots of things that you need to research. So we are gonna be working with bipolar disorder, generalized anxiety disorder, and schizophrenia. So you need to make sure that you have a really good understanding of those diagnoses, including what they are, what the symptoms are, how they get diagnosed, what do we do for treatments, right? But also you need to think about things that apply to all mental health patients, because remember, you're going to be in the role of the patient for at least one of these scenarios. So things like, have you been medication compliant? Why or why not, right? Have you used other things to help cope with the symptoms of this illness that you have? Have you used drugs? Have you engaged in illegal activity? What has that looked like for you? Have you guys been to psych clinical? Okay, what do we see on the unit? What comes with mental illness for these patients a lot of times? We see lots of substance abuse, right? It's not the norm to have a negative UDS on the adult unit, right? Most of our patients are at least positive for marijuana. We see cocaine, heroin, meth, all of the things. All right, why is that, do you think? Coping mechanisms, right? They're dealing with some pretty difficult things. Also remember that mental illnesses affect the way that a patient thinks and how they respond to things. So they may just not know what they can do outside of drugs, or they may have tried other things and it didn't work, and this works, right? So there's real reasons why our patients turn to these things. What else do we see? What's our support system look like typically for a patient who is hospitalized on the psychiatric unit as an adult? Not great. So we know that patients that don't have good support systems tend to have poorer outcomes. So you want to make sure you're thinking about all that so that when you are in the role of the patient, you can provide that information to your nurse. You also want to think about in the role of the nurse, how you're going to ask all those questions. Okay. You could also think about medications that could be used. So if we're looking at bipolar disorder, and that's the one that you want to play out, what are some medications we might use for bipolar disorder?
Lamotrigine.
Okay, lamotrigine. What kind of medicine is it?
A mood stabilizer.
It is a mood stabilizer. What's its class, though? We use it for mood stabilization, but it's actually a what?
I know, if I can't think of it.
Yeah, say it louder. Yeah, it's an anti-epileptic. So remember, there are several anti-epileptics that we can use for mood stabilization. Sometimes your mental health patients do have seizures, but a lot of times if they're on that, it's going to be for that mood stabilization effect. Okay, so what might be a reason that your patient stopped taking their lamotrigine? They felt better, or they had a side effect, or they got a rash and they weren't sure about it, so they stopped it, right? Lamotrigine is notorious for causing a really bad rash. It's one of the reasons if they stop it or they're non-compliant, we have to start them back at a teeny tiny dose. We can't just start them back at the dose that they were on. So there may be really good reasons why your patient has stopped taking their medicines. And it's important that we're empathetic and we kind of meet them where they are so that we can provide the best care. That's the whole purpose of this simulation. All right, there is a video here that has an overview of a psychiatric interview that you're welcome to watch. Down below we have community resource or research. So part of this clinical is also looking in your own community and seeing what mental health resources are out there. And you can choose Auburn Opelika or you can choose your home community. The goal of this is for you to kind of be aware what's out there, because statistically most of us are either going to need it ourselves or need to refer someone that we know for mental health treatment, right? But also you just may be in a rural hospital where you don't have a social worker you can call. So we want you to kind of know how to find this information and what's out there. You're going to put that on your SOAP note when you turn it in. All right, any questions about this column over here? Okay, we're going to move over to the other column. All right, over here is a lot of words that you are welcome to read on your own. Basically, it's telling you what the roles are, the patient and the nurse. It's going to tell you what our objectives are. And then there are scenarios. Okay. You have 6 scenarios to choose from. You need to prepare to be the patient for at least 2 of them. Reason being is we're not going to do the same scenario twice. So if you happen to get in a room with an Auburn student who's the patient first and they pick the scenario that you had picked out, we want you to have a backup ready to go. So prepare 2 scenarios, or be prepared to fight to go first to make sure you can do your scenario. And make sure you have all that background information we just talked about. Okay, so this is a scenario and it's going to give you a brief amount of information. And this is your starting point. So this is not the complete thing, right? You're going to be in your interview for about 35 minutes. This is not 35 minutes worth of stuff to talk about. So this gives you brief information as a starting point for you to build that information, for you to pull from your mental health knowledge and think about background information, support system, what medicines or coping skills you have used in the past, were they effective or not, all those things we just talked about. All right, think about the symptoms you might be having. This one is anxiety, so think about symptoms of anxiety and how you're going to portray those to the nurse. And think about not just what you're gonna say, but how are you gonna act. So if I say that I'm feeling really anxious, but I'm talking like this is not portraying anxiety, right? So make sure that you're paying attention to what your objective signs are, not just what you're saying as the patient. Okay, there are some things for you to think about, but again, this is just suggestions. We really want you to take the scenario and run with it and make it your own. Right. Any questions? Okay, let's keep going. Then you have your required documentation. This is what you, in the role of the nurse, are going to complete. All right, this is SOAP note, and this is probably the thing that gives you the most trouble. And I'm gonna tell you the 2 sections that give you the most trouble are the assessment and plan. All this is a care plan, all right? We used to do care plans on every single patient that we touched. We don't do that anymore. I'm thankful we don't do that anymore. But I do think it's important that we do at least a couple, and we know how to plan care for someone with mental health issues, right? Because where are your patients with mental health issues at? Everywhere, right? No matter where you are a nurse at, you're gonna have patients who have mental illnesses. So it's really important that you know how to take care of them and how you can therapeutically communicate with them so that we don't make matters worse. Okay, so diagnosis, that's gonna be whatever your patient is acting out. Subjective and objective assessment, we know what those are by 4 semester of nursing school. Do note that your objective assessment is basically your mental status exam, which you also have to do and turn in for this. So that's where most of your objective assessment information will come from. A assessment is your 2 priority problems for this patient. So what you're not gonna do is pull the book on schizophrenia and say, well, schizophrenic patients typically have this, so these are my priority problems. Based on the assessment of your patient, you're gonna tell me what those priority problems are. All right, what is this?
Maslow.
This is Maslow. This is how we decide what the priorities are, right? So if your patient is breathing, sleeping, doing everything they're supposed to physiologically, what's our priority problem? Safety, yes. Most of these problems are going to be safety problems for at least one of them. Okay, they may be a risk to themselves, they may be a risk to others. There may be a risk secondary to their symptoms. So it may be risk to others due to paranoia, right? Or command hallucinations, or suicidal ideations. So something safety related is going to at least be one of your problems. All right, ineffective coping, also a pretty common one that we see, just as some examples. All right, so if we pick 2 priority assessment problems, and let's just say that we're gonna do risk of harm to others, and we're gonna do SI, suicidal ideations. Okay, for each of these priority assessments, I have to have 2 SMART goals. So how many SMART goals do I need total? 4, yes, at least 4. So if I'm doing risk of harm to others, what would be a goal for that? Yeah, that's exactly right. It's a great goal. So in order for it to be SMART, it has to be specific, measurable, achievable, relevant, and time-bound. So not hurt others checks a lot of those boxes. What it's missing is time-bound. So a really good goal would be patient does not harm others while on the unit. Okay? And then we would need nursing interventions for each goal. Goals are always written in the patient, right? What the patient's gonna do. Nursing interventions are written from what the nurse is gonna do. So what is the nurse gonna do for this safety goal?
One-on-one, maybe?
Maybe. We're at least gonna do close monitoring, right? Close monitoring. What else would we do? How do we keep our patients safe on the unit?
Environmental.
Yeah, what's that called? Therapeutic milieu. All right, we're gonna put them in a therapeutic milieu. What else do we wanna do?
Remove all harmful.
Absolutely, okay? Limit access to items that may be harmful. Okay, what's another goal? If my patient is a risk of harm to others, let's think about how this plays out on the unit. If you have a patient who is aggressive on the unit and they are starting to get worked up, what's an intervention that your nurse may do?
Anger management, like ways to calm down.
De-escalation, okay, and if de-escalation doesn't work, what might we do?
Remove them or either remove the other.
Okay, so we're gonna separate them. What else?
Physically restrained.
Medication, yeah. So a goal may be that my patient doesn't require PRN medications for a couple of shifts before discharge, right? What I'm not gonna say is patient has less harm to others or something along those lines, because I can't measure that. It's also really hard to measure anger management. I could say patient will voice 2 coping skills that he can use when he gets upset though. That's measurable, right? I need to say when is he gonna do it, maybe by discharge. It's specific, it's measurable, it's obtainable, it's relevant, it's time bound. Do you guys see how we kind of take those ideas and then we turn them into something that we can measure and make them a SMART goal? Okay. All right, for suicidal ideations, what would I want my patient not to do? What's a goal?
Kill themselves.
I don't want them to kill themselves, right? Patient will not harm self while on the unit, I like it. What else?
I'd like to stop the suicidal ideation.
Okay, suicidal ideations for 48 hours maybe prior to discharge. Okay, patient will not harm self while on the unit. That's pretty specific, measurable, attainable, relevant, and time-bound. Patient will not voice suicidal ideations for 48 hours prior to discharge. Let me tell you why I picked this rather than patient doesn't have suicidal ideations. I can't measure what someone's thinking. So be careful about putting that as a measurability. You can measure what they say and what they answer, what they do, but you can't measure what they're thinking. All right, and then for 48 hours prior to discharge, they're coming in with suicidal ideations, then having them none while on the unit is probably not gonna be attainable. It's not gonna be correct for your patient. But ideally, I want that to go away before I send them home so that they're not a suicide risk, right? So this is saying, hey, before they go home, we have improvement. For 48 hours, they're gonna tell me that they're not having suicidal ideations. All right. Okay, so these nursing interventions are gonna be the same as these over here. What would I do for this one? How am I gonna know if they're having suicidal ideations?
Interview.
Yeah, I'm gonna assess. What else? What about building a therapeutic rapport? Why would that be an appropriate nursing intervention for this?
Because they gotta be able to trust someone.
Correct. In order for me to trust that they're saying yes or no to suicidal ideations, they have to trust me. So I need to build that therapeutic rapport to know that that's a genuine answer that they're giving me. Okay, questions? Okay. And then education is gonna be 2 to 4 specific education points for your patient. So again, I don't want you to pull the book on schizophrenia and talk about paranoia and hallucinations and delusions and all the negative symptoms if your patient isn't having those. So make sure it's very specific for your patient and also relevant. If your patient is acutely psychotic, it's not the time to be doing lots of in-depth education. We need to keep it simple, let them know exactly what we need them to know, and that's about it. Questions on the SOAP note? There is an example SOAP note on Canvas, right, so you can refer to that. Below your SOAP note is an intake form. You don't do anything with this before you come other than just read over it so you know what questions you're gonna be asking. We are gonna challenge you in telehealth to not just go down this list of questions, to use therapeutic communication by asking open-ended questions. So it may be a good idea to go ahead and look through this and think about, how can I ask these in open-ended questions? So rather than going down this list of things, I might say, hey, how have you been feeling lately? And then ask questions based on what that answer is. Okay, any questions on the intake form? It's kind of lengthy, but it's just an intake form. And then your mental status exam, you probably have already seen before. Everyone's seen a mental status exam before. Okay, it's the same, it didn't change. I do recommend you either have these available on a screen that you can edit, or you print them out. If you don't have 2 screens, it may be easier to print them out so that you have your interview on one screen and your documentation where you can write on it. All right, and then after telehealth, you have your link here. It's gonna be due Sunday night after your telehealth at midnight. So you've got some time to work on it. I do have some kind of tips before submitting based on documents that I've had to send back to students in the past. It's usually for the same kind of things. So this checklist is just kind of to help you go through, make sure you've done all of these things. And then over in the resources, there's your example SOAP note. There's some mental status exam tips here for, hey, what am I assessing with the mental status exam? There's a medication list here for you to make sure you've looked up these specific medications, but there's also some classes that may come up based on whatever the student or you say that you've been on previously. There are also some lecture videos here. This is my lecture videos when I teach 114. They are long. It's like probably close to 4 hours of lecture video. You do not have to watch all 4 hours of lecture video. But if you know that you're not real sure about schizophrenia, skip to the part about schizophrenia and watch that. There is also a free mental health textbook. And I really like this book. So let's say that, and I would save this because you're probably gonna want this again next semester as well. It's also gonna be beneficial for lecture, what we're talking about today. But you can just, if you're not real sure about anxiety disorders, here's your chapter on anxiety disorder. Kind of takes you through everything. And then it also has nice little learning activities at the end. So it's free, use it. All right, any questions about the telehealth module in general? Okay, fantastic. If you have any, just shoot me an email. All right, let's get started with the lecture then.